Welcome back to Starting Point, everybody. Reforming Medicare is sometimes considered to be like the third rail in politics because 80% of Americans say they wouldn't cut Medicare at all in order to lower the federal budget. There is a new plan to secure the system today, and it's coming from Republican Senators Richard Burr and Tom Coburn. The Seniors' Choice Act is what it's called, and it would do this. It would allow for a private plan that would compete with Medicare to be paid for by the government, increase the age of eligibility from 65 to 67, set a new cap on out-of-pocket expenses, and include means testing, meaning that wealthier recipients wouldn't have to pay more. Joining us this morning, the authors of that plan, Republican Senator Richard Burr from North Carolina and Republican Senator Tom Coburn from the state of Oklahoma. Coburn is also a doctor, I might add. Nice to see you, gentlemen. Thanks for being with us.
Good to see you. Good morning.
And you heard me say sometimes this is described as a third rail of politics because nobody wants, no voter, not one, really wants this messed with. Why did you think this had to be done?
Well, so that everybody in Washington sits idly by as the actuary from CMS and the Congressional Budget Office tell us about the insolvency of Part A Medicare sometime between 2016 and 2022. Tom and I felt that as a member of Congress, we had a moral obligation to our parents and to our children to make sure that we saved Medicare, that we put it on the financial footing that we would expect to hand over to them. And as we did that, to create choices where seniors could choose how they navigate health care, which is very difficult and very expensive. And what we've done is we've put together a tremendous blueprint that will seek the input of seniors, stakeholders, insurance companies, and government officials over the next several months.
Let's walk through that blueprint, because of course the focus is always on how do you get prices to come down, right? That really at the end of the day is what you got to do. So there's two theories. You have the government. If the government is sort of in charge of the medical care, they can be the 600-pound gorilla and they can drive prices down just because they're sort of the 800-pound gorilla. The other side of that would say you shift to private coverage, and that allows competition, and competition in and of itself brings prices down. What do you focus on in this?
Well, look, the one question that's not getting asked in our country today is, what does it cost? And why does health care cost so much? Why are one out of every $3 that are spent on health care, not just in Medicare, but in your own private health care, not helping anybody get well, not preventing anybody from getting sick? Why is that? And the reason that we're there is because all of us think somebody else is paying the bill. So one of the ways to have better scrutiny on, and also better outcomes and better values, is to reconnect payment and purchase to a point where we can actually save Medicare and improve the outcomes. And that's what we're trying to do in this. We're trying to allow market force with both traditional fee-for-service. You can be in either one of those you want. You can go out and buy what you want, or you can stay right where you are, but have them competing against each other and have some connection to what something costs with something new. And that's why we limit the availability of zero dollar coverage as far as a supplemental policy.
But in private insurance, if I am very sick, I cost more. My premiums are higher than someone who is perfectly healthy. And don't you run the risk that people will leave out of sort of the government-paid portion of Medicare, meaning you leave behind the people who are sicker because the people who are healthier can opt into something that's going to cost them less? For people who are going to have very high premiums because they're sick, they're going to stay with what they have, and that in and of itself is going to cost more.
Well, Soledad, it costs the same whether the American taxpayer pays for it, or it's paid for out of the Medicare trust, or it's paid for out of a private insurance plan. What we've tried to do is exactly what we did when we created Part D Medicare, the prescription drug plan. We've instituted competitive bidding, but unlike any proposal that's happened in Washington on Medicare, we've said we want to keep fee-for-service, but we want it to compete with private coverage. And through that competitive bidding process, what we're going to see is a more efficient and transparent fee-for-service, traditional Medicare. And we think we're going to see what we saw in Part D, which is new, innovative types of coverage. At the end of this process, what we've got to do in policy is try to help the American people make smart health care decisions. We've got to keep people well longer. We've got to get them well faster. We've got to keep them out of the hospital. And we've got to really focus on how we maintain chronic disease, not just with seniors, but all Americans.
How does that differ? So let me explain something to me. How does that differ from Medicare Advantage? Because when they break down the numbers on that, it's actually something like 11% more expensive.
Well, it is, but Medicare Advantage was designed that way from the beginning because many members of Congress in rural areas felt they wouldn't have Medicare Advantage unless they overpaid for the premium. So we've got to change that, but more importantly, we can get private sector competition and then let seniors choose. I think transparency and choice are absolutely essential in whatever the final product looks like.
How likely is this going to actually move forward? As I started with the polls that say 80% of the people don't want you to touch it, and we're in an election year.
Well, I think that's the real, that's the problem with Congress and leadership in Washington today. We're going to do what seems to be politically safe rather than fix the real problems. Is it important for us to ensure that there's solid health care for seniors in the future? And is it important that our kids have a future by not consuming their future through that program? And I think the fact that people are willing to stand up and talk about it is exactly what the American people want. There's a big lie going on, and the big lie is this, Soledad, is Medicare is just fine. It's not. And in less than 4 years, maybe 5, the trust fund that pays all the hospital bills is going to be out of money. And the time to fix that is now, not when the house is on fire. You put a smoke alarm in before, and now's the time to do it. And we can do it in a way that assures better care, lower costs, and more choice. Why would we not want to do that? But why? Because it's difficult for the politicians to get reelected? I think that's the last thing the people in this country care about.
Yeah, but sometimes the elected officials care a lot about it. Senator Tom Coburn joining us this morning.
That's what's wrong with the system.
Believe me, sir, that is a topic for another day, and I would agree with you on that. I appreciate your time, gentlemen. Thanks for being with us.
Thank you, Soledad.
See you.
Still ahead this morning on Starting Point.